The healthcare sector is under pressure to adapt, with demand for the treatment of mental health disorders increasing since the COVID-19 pandemic. The game changer needed could well be artificial intelligence, which is helping to provide effective and personalised treatment plans. Luke Balcombe joins us now, researcher at Griffith University. Luke, it's great to have you with us today. Welcome. Can you give us some examples of what it's being used for now, today? You know, is AI going to be my therapist in the future?
Yeah, well, it can already be used as your therapist through chatbots, and there are chatbots available such as Wobot, which has been effective for treating anxiety and depression. However, at the moment, we would recommend blended care where there's a mix of digital mental health technologies, such as using the Head to Health platform in Australia, or other face-to-face measures, which are traditional care, such as visiting a psychologist or a psychiatrist. And that usually starts out with seeing a GP. So that can be the hardest starting point for a lot of people, is making that first step or finding the time.
Now, obviously, you know, while there's all this upside that you've sort of been talking through when it comes to using AI, it also does open up the potential for misuse and of course, mistreatment. How concerned should we be, and how do we protect ourselves from that?
Well, of course, we should be concerned about the misuse of AI, and that's because it can be used in psychological warfare, in social media to influence election results, or it can be as simple as providing misinformed information about our mental health, which it could be in the example of YouTubers providing their perspective or uninformed or unverified information about mental health to YouTube users. So if those kind of platforms are being used and watched by millions of people, well, then researchers need to go to where people are using information for mental health and look at what actually goes on there.
Luke, just briefly before we let you go, what are the most promising developments when it comes to AI and mental health?
Well, I think that one of the areas is collaborative AI, and that's where you have AI, multiple models, not just one model, such as a recommendation algorithm, working in these social media platforms, either with the social media companies or independently, so that you tackle issues such as misinformation, cyberbullying, as well as the potential for the wrong information or unvetted information being spread among millions of people. So I think there is a potential for sentiment analysis, through using generative AI, and that can help gain user feedback, which is very useful in determining what the user needs are and what the user experience is to improve the human factors of AI.
Okay. All right. It sounds very exciting, Luke. We really appreciate you sharing your insights, your expertise with us here.
You're welcome. Thank you, Ariel.
Thank you for joining us on APAC Weekly. To stay across the important conversation shaping our future, visit us at apacnetwork.com.